Dr. R is a Nigerian resident doctor at a cottage hospital and the most junior member of Professor P's team. They are managing a case involving a gunshot injury sustained at a nearby nightclub.
Please watch the video carefully and then return to this section. Take some time to analyze the case you just viewed. You may need to pause the video or take screenshots of the slides for reference. It's important to do this with a group of 5 to 7 people. At the end of the video, there are additional references to assist you with the fundamentals of medical ethics and medical jurisprudence. To fully grasp what you need to analyze, it's essential to watch the video at least 2 or 3 times. If you prefer, you can skip this part and head directly to the reference section. Please download a copy of the World Medical Association (WMA) Medical Ethics Manual, as well as the Nigeria Code of Medical Ethics from the Medical and Dental Council of Nigeria (MDCN). During your exams, you may encounter case studies. Use this video to practice analysis and come prepared with questions. You can also explore additional sources. Note that the Nigeria Medical and Dental Act, the Modern Physician's Oath, and the International Code of Medical Ethics apply to Nigerian doctors. It is possible that the sequence of the video is not perfect. Comment about the quality too. This is for reference only. Please download a copy online and read the highlighted portions for the video. All sections are important, not just for the second part, but also for practicing according to the medical code. It's surprising how many graduating doctors haven't reviewed this crucial document. Please make sure to read the entire code before graduating. You can pause the video and take a screenshot of the slide to view each topic relevant to the second part of the video you are about to watch. Topics such as informed consent, medical malpractice, conviction for a criminal offense, euthanasia, abortion, inappropriate relationships with colleagues, fitness to practice, and drugs and alcohol are important for analyzing this second case. Please pause the video to access the link or web page. Download the Nigeria Medical Code and the minimum training requirements below the link. These materials are essential for your undergraduate training. Don't forget to explore additional resources on current topics like AI and technology ethics. Note this: you can't escape a medical malpractice suit if you don't practice according to the code. Dear viewer, to ethically break bad news without legal issues, use the breaks and spikes protocol. Following these guidelines ensures safety when delivering difficult news, a crucial skill in today's world. Remember, breaking bad news can significantly impact careers and homes. Pause the video now, trace the link and read the articles. Share your thoughts afterwards. You have reached the end of the references. Before watching the second case, please do the following. 1. Read the International Code of Medical Ethics. 2. Review the duty of physicians. 3. Read the Modern Physician's Oath. 4. Download and read the Medical Ethics Manual, focusing on its history, basic information, principles, and cultural and religious considerations. Welcome to the second case.
Welcome to part 2 of the story. You might be wondering what happened to Chief. He was released on bail and charged in court. He was ordered to pay for Dr. R's treatment and was required to pay some fines. However, due to the poor treatment of his late son, his fines were withheld. Tragically, he had to bury his eldest son. His fifth wife was devastated, as was Olu, who had been with him. Late Kamo's father, the chief, was married to 5 wives. The first wife had 3 daughters, but no sons. The second wife had an abortion when she discovered that her child was female. Due to the absence of a male heir, the chief took additional wives. Eventually, the 5th wife had a son through her 3rd surrogacy business, but the chief disowned him because he could not be considered an heir. The 5th wife, Mrs. Kemi, was involved in a faulty surrogacy business in which she arranged to keep the child until he was grown. Furthermore, there was no legal contract, and the chief was unaware of this until after he married her. Kemi received payment from her clients. However, this time, the client's spouse did not agree to the surrogacy and decided to separate from her partner. When Kemi gave birth to a baby boy, Chief learned that a beautiful, unmarried woman had delivered a child without a father. He took steps to propose marriage to her, promising to acknowledge and raise the child as his own. Since Chief was a respected and wealthy traditionalist, the woman, uncertain about her surrogacy situation, accepted his proposal. But other wives disliked the mother and child. Chief was very fond of his 5th wife, so he arranged for a wealthy relative who owned a chain of nightclubs and hotels to reserve a room in one of the clubs where she could care for their child as she grew up. A few months passed during her pregnancy, and she eventually gave birth to a son named Kamo. An heir was born, and the chief was filled with happiness. Several years have now passed. It has now been 20 years. All the other wives have had 1 or 2 sons, and the chief's popularity has grown day by day. Olu has mastered the art of managing a club and is now in charge of one of the chief's relatives' clubhouses. He is respectful, loving, and kind. Kamo, the chief's eldest son, sometimes comes by to work for pay and to have fun. They enjoy each other's company a great deal. Olu's mother no longer conducts surrogacy business. Instead, she helps couples navigate pregnancy issues. During one of her counseling sessions, she learned about a couple facing marital problems who had a beautiful daughter named Neki. She helped them address their issues and subsequently became friends with the family. Olu fell in love with Neki, who is now a nurse at a nearby hospital. Neki is an experienced ER nurse who consistently exceeds her supervisor's expectations with her competence. However, she lacks compassion and tends to focus mainly on monitoring vital signs, following orders, and managing her work shifts. As a result, she does not build relationships with her patients and typically refers any social issues to the doctors. She is a typical duty-focused nurse. Dr. R has just graduated from medical school and is now officially recognized as a physician under the Naba Medical and Dental Act. Fortunately, he received thorough training in medical ethics and jurisprudence during his studies. He is aware of cases involving medical negligence and malpractice and understands their potential consequences. Is he applying the ethics he has learned? Dr. R is now a house surgeon at a tertiary hospital located near a notorious club. He is handsome, intelligent, and very sociable. Many of the clubgoers seek his medical assistance for issues ranging from abortions to complications related to illicit drug use. It's surprising how his ethical knowledge seems to have faded since graduation. Although he is smart, like Neki, he lacks good morals. In the Naba community, all forms of abortion, mercy killing, or euthanasia, working as a doctor full-time in 2 places, defrauding patients, deception, and other types of medical malpractice are punishable by law, and Dr. R is aware of this. He believes that his cleverness will always help him evade trouble. But is this always the case? It is important to know that it's not always the case. Professor P, Dr. R, Dr. Bruno, and Nurse Neki have been summoned by the hospital's disciplinary committee. A complaint has already been filed in both the local village court and the modern high court. The Naba investigating panel, which functions as a high court, has summoned Dr. R and Prof. P. Dr. R must ensure that he appears promptly before the disciplinary tribunal. The case is now escalating. Dr. R receives a summons to appear before the court, where an expert witness has also been invited. His hospital, facing vicarious liability, is present alongside the head of the team, Prof. P. They stand before an experienced judge. After undergoing cross-examinations, Dr. R pleads guilty to 3 charges, which range from mishandling the delivery of bad news to handling Prof. P responsibilities. The case has been brought before the Naba Medical Tribunal. Both Professor P and Dr. R faced the possibility of having their names removed from the medical register. However, after careful deliberation, the tribunal decided on a lighter sentence. Professor P received a reprimand and was fined. He was also suspended from leading the team for 1 year, while Dr. R worked without pay for 6 months. Back at the hospital, the management summoned the entire surgery and emergency room (ER) team. They set up an inquiry panel, conducted a joint mortality review, and organized training on healthcare ethics and medical prudence. Nurse Necki was assigned to speak on the nurse-patient relationship, while Bruno, Dr. R's colleague, addressed the physician-patient relationship and breaking of bad news. This led to a series of brainstorming sessions on preventive and mitigation measures. The problem tree analysis technique was used to formulate policies and guidelines. A healthcare ethics and legal unit was established. Professor P, Dr. R, Nurse Necki, and Bruno are now trained educators. The incidence of conflicts is now almost non-existent. The team is awarded a national prize for their actions.
Now that you have watched the animated video, please share your thoughts in the comment section. What did you learn from it? If you were one of the characters, what would you have done differently? Have you ever read any local or international articles about the increasing cases of medical malpractice lawsuits? Please share with us what you know and what we all could do to improve our practice. Now that you have watched the animated video, please share your thoughts in the comment section. What did you learn from it? If you were one of the characters, what would you have done differently? Have you ever read any local or international articles about the increasing cases of medical malpractice lawsuits? Please share with us what you know and what we all could do to improve our practice.